Thank you for joining us for How to Detect, Prevent, and Manage Hypoglycemia. My name is Jonathan Halldorson, and I am a registered nurse and working as a nurse for a little over 5 years in both inpatient and outpatient settings, and have enjoyed the outpatient endocrinology and diabetes focus, so I'm glad to be joining all of you today. The agenda for today is focusing how to monitor blood glucose levels and how does this help manage diabetes and detect hypoglycemia or low blood sugar. I also want to talk about what are the strategies for preventing and reducing risk for hypoglycemia. How do we treat it? And we'll end with some patient stories. What does that term hypoglycemia mean? Well, hypo means low, and glycemia means the sugar in your blood. And we'll be saying either blood sugar or blood glucose interchangeably during this presentation. So by definition, a hypoglycemic event, or a low blood sugar, is when your blood sugar is less than 70 milligrams per deciliter by a test. Either you can do this on a glucose meter through a lab test or through a continuous glucose monitor. So low blood sugar, why are we talking about it today? Well, it's one of the greatest immediate dangers with diabetes. Low blood sugars can be very dangerous by causing acute, meaning in the moment, but also some long-term complications as well. So it's one of our biggest focuses as your clinical team. There are different stages with hypoglycemia. There's mild, which is when your blood sugar drops below 70, moderate, which is under 54, and also severe, which by definition can mean a couple different things. Either severe cognitive impairment, where you need someone else to help you correct a low blood sugar, or when your blood sugar is under 40, but you still might have that cognition present. Let's talk about monitoring and how does that help manage and detect low blood sugars. So the only way to really know if your blood sugar is low is through self-monitoring a blood glucose level. And fluctuations are expected and normal, but we want to be able to catch lows and highs, and there are multiple variabilities with everyone. There are many factors that can impact your blood glucose level, so it's important that we individualize your diabetes care. Self-monitoring your blood glucose in between doctor's office appointments and nursing appointments, or anyone with your clinical team, can help you know if you're meeting the specific treatment goals of keeping your blood sugars at a specific level. People with diabetes can adjust medications based upon those numbers that they're getting at home, as advised by a medical team. We can also identify different trends for maybe why hypoglycemia or hyperglycemia are happening, and in turn, hopefully prevent them by implementing some changes. It is an essential component of diabetes management, and it benefits all people who have diabetes. Knowledge can be empowering. So how do you get that blood sugar or blood glucose level? Well, there are many blood glucose monitors or meters on the market. They all function very similarly and look very similarly, but many different companies make them. So there's in the moment finger stick, where you would lance a fingertip, usually is the most common location. And a drop of blood goes into a meter that will tell you what your blood glucose level is at that moment in time. So if you have a blood glucose meter at home, when should you be testing? Well, it's nice to test at different times of day in order to get variable information. There are different times that your clinical team might suggest testing, such as a fasting glucose level in the morning, or whatever is going to be 8 hours after any caloric either food or beverage. Other times that you could test would be before meals, after meals. You can ask your clinical team how long after a meal you should test. Before, during, or after exercise, because blood glucose can change throughout that period of time. And an example would be either before going to bed, middle of the night, and that would be to help detect if you're having a low while you're sleeping that we might not have known otherwise if we didn't test. And it's always recommended when you feel symptoms of a low glucose level to check your blood sugar and verify if it is indeed low and how low, so you'll know if you need to and how to respond. And then there's other times of variability in our lives that we recommend testing, such as when you're feeling ill, when you might be stressed out more than usual, or maybe when you're traveling. And this will help both your clinical team and you be able to monitor and get some information on glucose levels in between clinical visits. A common question that comes up is, well, that A1C test that my doctor does, can that A1C be used to check for low blood glucose levels? And the answer is no. Your hemoglobin A1C that we would do either at your doctor's office or through a lab draw, it measures your average blood sugar over the past 2 to 3 months. Now, that means it's not necessarily going to highlight the highs and lows, but give you an average level. And A1C can be individualized. Your clinical team will give you your goal A1C. It's typically under 7%, but there are some variations in that. So ask your doctor if you're not sure. And the reason that we bring this up is an A1C result might come back and be either normal or high, meaning on average your blood sugars are trending up or elevated. But that individual might still have hypoglycemia or low blood sugars in that 2 to 3 month period. So this highlights the importance of checking blood glucose levels in the moment with either a meter or a continuous glucose monitor. Now let's go into a comparison or an example of maybe why that might be the case. So here in front of us are 2 different A1C values that we can extrapolate from data. Let's say patient A is on the left. Patient A's blood sugar varies from maybe about 80 to 160 throughout the day. So that patient's average glucose for that day is 123. And this is data from a continuous glucose monitor that's checking blood glucose every 5 minutes. So this is how we know the variability. Let's take a look on the right at patient B. So throughout their day, they're going from, let's say, about 55 or 60 up into the 2 to 300s. So that variability still gives us an average glucose level of 121. And you can see from the left and right, the average blood glucose levels are very similar. But yet patients on the right is experiencing much more variability, having many highs and many lows. Now let's say this is a typical day for them, and patient A on the left has this as their typical day for the next 3 months, and patient B on the right has this as their typical day for the next 3 months. Their A1C values may come back at 5.9 for both of them, and that highlights how a 5.9 does not shed light on the either severity or frequency of both highs and lows. While A1C can be very helpful in order to detect and monitor how well treatment is going over periods of time, self-management of your blood sugars by either a meter or a continuous monitor is the hallmark of how to manage and observe glucose levels on a day-to-day basis. Not only just observing, but being able to take that data and do something about it. And we're going to go into that in a little bit as well. So how can blood glucose patterns and trends be helpful? Well, if you're doing capillary or fingerstick blood sugar checks, it can be helpful to either log that in a journal or perhaps a cell phone app. Those data points over time can help shed light on how often glucose level is within this what we call target range, or your time in target. It can also identify maybe trends of days and times when hypoglycemia happens. Maybe it's consistently happening right after a certain medication is given, or a certain day of the week. Maybe you exercise more on the weekends and you notice hypoglycemia on the weekends. It can help draw some lines. It can also identify not just possible causes, but what to be done about it. So if it is related to exercise or medications, maybe there's strategies that we should implement in order to prevent them. And we're going to talk about that in a few slides. So when blood glucose levels are consistently out of goal, either persistently elevated or persistently low, it can be difficult to manage diabetes alone. So it's recommended to discuss these kinds of concerns with your medical team. And without self-management of blood glucose levels with either a monitor or the continuous meters, it's difficult for your diabetes team to know what's going on at home in between visits. As we saw earlier, the A1C test only tells us so much, but blood sugar data at home is really how we'll be able to identify how you're doing and if anything needs to be done. So what is a continuous glucose monitor? We've mentioned this before, but what is it? What is a CGM? A CGM is a small device that's placed underneath your skin, and it's constantly measuring glucose levels every 5 minutes. If you go on a CGM, then it's definitely recommended to talk about this in great detail with your care team, because there are important differences between a finger stick level and a CGM level. But what this does is every 5 minutes automatically checking a glucose level and presenting that data in either a receiver, a device that the company will give you. It can go to a cell phone, and it'll tell you where your glucose is now, but also where your glucose has been fluctuating in the past, and likely where is your glucose going. It'll give trend lines for, is your glucose rising, falling, or is it relatively stable and flat? Now, the CGMs can be particularly helpful because there are reports that can come back through different software or in the app or receiver itself to tell us what percentage of the time have your glucose levels been within goal range. It can also tell us the frequency of blood glucose at a specific level. It can tell us the amount of times you've had a hypoglycemic event in a period of time. It also measures changes throughout the day and shows the variability in a trend line, as we've seen before in that printout. And it can identify and, in turn, prevent both high and low blood sugars for a couple different reasons. Some will have alarms for specific triggers, which can help when maybe you get alerted before you feel symptoms of either a low or high. But it's also live in the moment feedback. So you can look at your CGM tracing and see the change over a period of a few hours and say, hey, when I did this activity or ate this food, this is what my blood sugar did at this time. It could be really helpful data. So here's another sample continuous glucose monitor report. This is where Monday, Tuesday, Wednesday, Thursday, Friday are all overlaid, and you can see the different trends, and it can highlight maybe certain patterns. As we can see, usually after meals, this patient's glucose levels are rising. The meals are that brown diamond section. So that tells us maybe diabetes medication regimen needs to be changed to help prevent the spike or rise in glucose after meals. Here's another example of reports available from a different continuous glucose monitor. It can show daily patterns, like I said, the percent time in range, your average glucose over a period of time, and that frequency of low glucose events. So for example, 6 glucose levels in the past 7 days were low from 6 p.m. until midnight. Maybe that's going to highlight and trigger someone to think, what's going on in that time frame that might be causing that low? So maybe we can change something, either decrease medications, adjust exercise regimen, something about that time frame to talk with your clinical team. So CGM can decrease how much hypoglycemia or low blood sugar a patient has to live with. There's 2 main studies that were done, research studies. that saw the change when patients were given a CGM, or continuous monitor, and we saw decreases in overnight or nocturnal hypoglycemia, decreases with serious hypoglycemia, but also the frequency of hypoglycemia, so how often they were experiencing them. So what do we do with that data? What are some strategies to prevent and reduce risk of hypoglycemia? Well, you can eat meals consistently, meaning try to avoid skipping meals frequently, or coming up with a strategy for when you do skip a meal. If you're on mealtime insulin, might be recommended to skip that mealtime dose because you don't need the insulin to cover the rise in glucose from food. But definitely talk to your care team about your strategies regarding insulin and different medications. And it's important to bring up fasting as well because certain holidays can trigger fasting. So being strategic around different periods of fasting and how your blood glucose will change from that. Another strategy would be to take the correct dose of insulin and making sure if you have questions about that to verify either on perhaps electronic record where you can log in to your care team and make sure that you know your current doses, or calling your care team. Taking your insulin or other diabetes medications at the correct time is very important, as different insulins have different action times for when they start working, when they're working at their most potent or their peak, and how long they work in the body. When are they going to be out of the system and stop causing an impact on your glucose levels? So knowing how far in advance to take mealtime insulin is important. And for other types of insulin, such as basal insulin, knowing if and when to take it consistently and at what time. Now let's definitely discuss alcohol. We recommend consuming alcohol with caution, since that can cause both high glucose and low glucose. Now, we don't need to say you can't drink any alcohol at all. So if you choose to drink alcohol, then having a strategy for overcoming the impact if it does cause hypoglycemia. So trying to eat a snack beforehand or during alcohol to prevent that low, or being very cautious and monitoring glucose frequently after drinking so you can see how it's impacting you and respond accordingly. And definitely checking blood sugars regularly when you're experiencing symptoms. Some symptoms might occur when you are not necessarily at a low glucose level. So verifying with an actual finger stick or looking at your CGM data to get a specific number can help validate and make sure that you're aware of what your glucose level is. So sick days. We like to talk about sick days and how to prevent hypoglycemia because when you're sick, lots of things can change. Stress hormones and what we call counter-regulatory hormones that cause blood sugars to rise are coursing through your body. It can also change your appetite, how much you're eating, how much you're drinking. Also, vomiting or diarrhea can change caloric or carb ingestion and absorption. So checking glucose levels more frequently during periods of illness is recommended. Making sure you stay hydrated with drinking plenty of water, avoiding certain over-the-counter medications that might have sugar or alcohol in them, and talking to your care team before you're sick to make sure you have a safe strategy and management plan in advance. Exercise. This is definitely something that can cause variations in blood sugar levels. Different types of exercise can cause different impacts on glucose levels, either causing glucose to fall, maybe stay stable, or certain exercise can raise glucose levels. So if you're not sure how your glucose responds to certain types of exercise that you're doing, we recommend checking glucose before, during, and after exercise to see how is it changing. How is that exercise impacting you and your glucose levels? We recommend also avoiding exercising when mealtime insulin hits its peak. That's when it's most potent and doing its maximal impact on glucose lowering. And being careful afterwards about heat, so saunas or hot tubs, as those can cause lower blood sugars. And again, like we talked about before, avoiding alcohol after exercise, as those can both compound and cause low blood sugars. Staying hydrated. Consider snacking before exercising to prevent that low if that's going to happen to you or has happened historically in the past. And consider adjusting insulin before exercise. And this is something to definitely speak to your care team about in advance to come up with a strategy for if and by how much you should change insulin regimen before exercise to help prevent. So let's talk about how to prepare for hypoglycemia. What should someone have on them just in case? We recommend always carrying a fast-acting carbohydrate or rapidly absorbed sugar. And we'll talk about a few items that are good examples of this. But fast-acting sugar is just something that is sugar or carbohydrate that doesn't have other things inside of it, like proteins and fats. If you're in doubt or in question, you can look at the nutrition label to see how many grams of carbohydrate there are and if it has any proteins and fats. And this is because that will help rapidly increase blood sugars. Another thing you can do is wear a diabetes ID, and that can be either a bracelet or other type of ID. This is for if maybe an emergency happens when you have a severe low and you need assistance from either emergency personnel or someone else. When they get to the scene, they might be able to identify that on your wrist or on your person and be able to know to check a blood sugar and correct in an appropriate manner. It's also recommended to not drive without knowing what your glucose level is and making sure it's in a safe range and that you don't expect it to fall during travel. Telling your friends, family, and coworkers about how you present with a low so that they'll know maybe that's a trigger for them to ask you to check blood sugar or ask you to get a snack if you're feeling low. People who are close to you, friends, family, and coworkers, should know where you keep glucagon and how to give glucagon. And glucagon is the emergency kit that can raise blood sugar rapidly. And we'll talk about that in a few slides. And if blood sugars are going low at night, remember you can have a bedtime snack before you fall asleep. A good example would be either yogurt or peanut butter. And that can help keep glucose levels stable throughout night. But if this is reoccurring and you need to do this, not a great long-term strategy to have to eat in order to prevent low glucose levels. If it's reoccurring, it probably suggests that we should change something in your diabetes regimen that will not cause you to go low overnight. So if this is occurring, definitely talk to your care team. So let's do an investigation. When blood sugars are low, it's a good trigger for asking ourselves why. What happened? What may I do in the future that might prevent this or make this not as pronounced? So example questions for yourself would be, did I skip a meal, but yet I took my insulin or other diabetes medication? Did I do extra exercise and my blood sugar fell from that? Or did I take too much insulin and not eat all of that meal that I was expecting to eat? These are things to ask yourself and kind of come up with some strategies for assessing trends and knowing if you need to change anything in the future. So how do you treat a low blood sugar? Treatment of hypoglycemia when blood sugars are under 70 by definition. If you are able to take oral or not take oral, that's going to determine the next step. So if you're able to swallow and keep glucose down, we recommend giving 15 grams of fast-acting carbohydrate, and that would be maybe 4 ounces of fruit juice as an example. But if you can't take anything orally, let's say you're persistently vomiting, or you're severely hypoglycemic and you are unconscious, then it's only safe to give glucagon, either by the same injection of a subcutaneous or in the fatty tissue, just like an insulin injection would go into, or intramuscularly, like where you would get a vaccination. So treating hypoglycemia, there is a strategy to help remind us of how to respond, and that's called the rule of 15s. So when you're checking a glucose level and you find out that it's under 70, if you're having symptoms or if no symptoms are present and you want to be careful, we recommend giving 15 grams of fast-acting carbohydrate, then rechecking your glucose in 15 minutes to see if it responded and by how much. So on that recheck, if your blood sugar is still under 70, we recommend repeating with another 15 grams of rapidly absorbed carbohydrate and then rechecking glucose in 15 minutes. Now, the caveat to this is the 15 grams of carbohydrate are recommended for the typical low blood sugar episode. When in doubt, you are safe to use your best judgment. If you have a severe low, or if you know more about actually the context of what's going on, it's safer to give more. You don't have to limit it to 15 grams. But the 15 gram of fast-acting carb can help with a rebound high, or overcorrecting and accidentally having a high blood sugar afterward. 15 grams typically will cause the low blood sugar to go back into a safe range. And if it doesn't, after 2 rounds of treatment, something is causing your blood sugar not to respond, and it's recommended to seek emergency care or call your doctor's office. And at the bottom, we can see after your blood sugar has responded, if it has, we can implement a strategy of eating a protein snack or eating a meal. And that protein snack can help sustain your blood sugar and keep it from going back low again. Because that's a risk, is if you've had a recent low, you're at risk for having another one, depending on what the cause was. So what are examples of those 15 grams of fast-acting carb? 4 ounces of juice or non-diet soda, making sure it actually has calories, those carbohydrates in it. A tablespoon of honey, 15 grams of glucose tabs, and double check the nutrition label for that. It's usually about 4 tablets to come up to about 15 grams, but some are different. You can also get glucose gel, maybe a tablespoon of sugar, a handful of candy, like Lifesavers, something that's just sugary, 8 candy corns. These are examples. So this is a great time to kind of reflect and think, what are some around the house or around the car or around my workstation, things that I can keep around me that are going to be my go-to treatment, so that when you do have a low, you already have a plan. You already have that 15 calculated out grams of sugar that are going to be fast-acting, that can help raise your glucose when you're having a low, so that you don't have to come up with that plan in the moment when you're having a low. So some important notes to mention: if you're going to have a meal, but not within 1 hour after a low when you've treated it, we do recommend having that small protein and fat snack with some carb in it, and that can help prevent another low blood sugar episode. And why we talk about this carbohydrate versus protein versus fat, why does this come up? Well, foods that are high in fat, such as chocolate or a potato chip, they're not ideal because they can delay the absorption of the carbohydrate and actually cause glucose levels to take longer to rise. So that is why we like to isolate the carbohydrate in the treatment source that you're going to come up with, and then afterwards have something that has some protein, fats, plus carb to sustain glucose levels. Okay, let's come up with a scenario. You're late to eat lunch. You feel a little bit dizzy, so you check your glucose level, and it's 65. Okay, so what's better, a glass of juice or a peanut butter and jelly sandwich? So now we're kind of thinking about sources of macronutrients, or those carbohydrates, proteins, and fats, and kind of dividing those up. So like we talked about before, isolating the carbohydrates to raise a glucose level rapidly is recommended. So drinking that glass of orange juice and then rechecking in 15 minutes is recommended. Now, the peanut butter and jelly sandwich is a great example from afterwards, after it's raised above 70, in order to sustain your glucose level, but not to treat the low. Now, the caveat to this is, of course, if all you have is a peanut butter and jelly sandwich, it's better than nothing. So if you have nothing around you and you have a low, generally recommended to have something. And this does have carbohydrate from the bread and the sugar from the jam as well. Now, what's better, Snickers or nothing? Like we said before, even though Snickers has chocolate, some peanuts, other things inside of it that might slow the absorption, this is that caveat of it's recommended to have a Snickers bar over nothing. So let's talk about, just in case, severe hypoglycemia. We had mentioned glucagon before, and that's the emergency glucose raising kit. So a severe glucose level when your blood sugar is under 40 or when you don't have full cognitive function, it does potentially require assistance from another person. So those who use insulin, especially those with type 1 diabetes, should have glucagon available and keep it by you or near you or with you at all times. So keeping a kit at home, maybe one in the car, one in your purse or backpack, or one at work, somewhere where you're always going to have it in case of an emergency is recommended. So glucagon is a quick-acting injection. It usually works within 5 to 10 minutes, and this is by someone else when the person with diabetes is either severely low or unconscious. The person who gave the glucagon injection should monitor afterwards and call 911 to make sure that you're either responding, that you are feeling okay afterwards, and if we need to do anything else after the glucagon injection. Now, there are resources available to know how to give the glucagon injection. There is the instruction kit. There's also useful apps on phones. There's YouTube videos, and there's always the option of asking your pharmacist, either a clinical pharmacist in your clinic or the retail pharmacist where the glucagon was dispensed. You can ask them for either a demo or a walkthrough of how to give that injection. And not only you, but you can bring family members, friends, or maybe even a coworker to the pharmacy or to your clinic with you so that they can go over a demonstration and feel confident in giving a glucagon injection. So here's an example glucagon kit. When you open it up, there's some pictures on the lid that will help step-by-step guide how to give an injection. And that's because there are a few steps. It comes with, as you can see on the left, a vial that has a powder. And then on the right, there's a syringe with liquid. Now those need to be mixed and then put into the syringe, which can then be administered to the person with diabetes experiencing a low. Now on that kit itself, it'll have an expiration date. So make sure to routinely check those dates. And if it's expired, feel free to use that as a practice demo kit. Play around with it, make sure you know how it feels, how to draw it up, feel confident in it. Then get a new kit to make sure that you have one that's going to work, that you can trust. So when should you call your healthcare team? Definitely call your healthcare team when you're having frequent or just severe low glucose levels. Like we said before, this is the greatest immediate risk for people with diabetes, so we take this very seriously. When you call in, your care team will talk with you about how to prevent and lessen the severity of or frequency of low blood sugars. You can call when your blood sugars are very high, when you're sick and have questions or blood sugars are not responding the way that you anticipate, with infections or non-healing sores on your skin, and then again, anytime you have questions. So hypoglycemia, it's definitely personal. People are impacted in different ways. It can impact missing work or school. If you have multiple hypoglycemic episodes over the course of time, it can start impacting memory or cognitive functioning. Hypoglycemia can cause other issues like high blood sugars, rebound highs from correcting lows, or maybe skipping medication due to fears of lows, so blood sugar rise. Hypoglycemia can also impact sleep. If you need to wake up in the middle of the night to correct a low, that can disturb your sleep, which also in turn can impact glucose levels. Your spouse or friends or caregivers can have worry for you. Hypoglycemia can cause weight gain due to overtreating lows or from the increased need or mismatch in insulin. So if you have more insulin than your body required, then that insulin, which is a growth hormone, can stimulate weight gain. Hypoglycemia and the trigger of increasing the frequency of your testing can increase the cost of either test strips, snacks that you have on board, or glucagon that you have to buy. Let's do a patient story. So this is Bridget. Bridget is a 53-year-old woman who takes metformin, which is one of the first go-tos for type 2 diabetes, and glipizide 3 times a day. She is walking around the mall by herself all morning. It's midday, and she hasn't taken her medications. She hasn't eaten yet, but it's noon, and that's the typical time that she takes her pills. So she takes her pills. She walks to her car and immediately feels dizzy and weak. She doesn't have her glucometer with her or her glucose meter, but she does have hard candy and a juice box in her purse. She eats the candy and drinks the juice, and she feels better. So she decides to drive back home so she can go get lunch. What are some things that we can learn from Bridget's example? Well, let's go through from start to finish. Let's see. So she's walking around the mall. So maybe this is more exercise than she's used to. Maybe that increased activity level drove her blood sugars down. She hadn't eaten yet around that time of the exercise, so maybe she knows next time she wants to go to the mall, she can have a little snack beforehand or during to help prevent that low. Maybe another thing to consider is she took her glipizide even though she wasn't eating around noon. So not taking the glipizide if you're not going to eat might be a strategy for her next time. She also felt low, but didn't know what her glucose level was because she didn't have her glucose meter. So maybe next time she'll feel more confident and safe. She kept her glucose meter in her purse or with her so that she knew how low it was. Maybe she wanted to do more than 15 grams of sugar, like in this example. But maybe it was 65, and maybe it was stable at that level, and both the juice box and hard candy were a little much, potentially. We don't know, right? Because before driving back home, she didn't have the opportunity to recheck her glucose level. So she didn't know at that time of driving if her glucose had responded, even though she started feeling better. So she didn't know if her glucose level was either normal or low when driving, and potentially doesn't know if it's going to go low in the middle of driving as well. Let's go through a second story. This is Sam. Sam is a 45-year-old male who takes regular insulin. He knows he's supposed to take it 30 minutes before eating, but he forgot and took it in the middle of the meal. 2 hours after eating, he's cleaning the dishes and he feels shaky. He decides to go upstairs to find his glucose tablets, and he passes out on the stairs. So what can we learn from Sam's example? Again, let's go top down. So he's on regular insulin, and insulin decreases blood glucose levels, but it also prevents the rise in glucose from food. And this is a regular insulin that is supposed to be taken with food, so 30 minutes before eating, in order to counteract that rise from the carbohydrates in the meal. But he took his insulin middle of the meal, so the timing is off. And it makes sense that maybe the overlap of the insulin and his carbohydrates weren't perfectly overlaid, and the insulin hung around a little bit later after his carbohydrates were already absorbed. So the insulin caused him to go low afterwards. And again, maybe this is in the context of a little bit more physical activity than usual. Maybe he's cleaning the dishes or being a little bit more physically active at that time when the regular insulin was taking effect. Again, we can take a look at the previous example and also this example and highlight how neither of them had their glucose meter readily available to them. So neither of them knew exactly what their glucose level was at the time of symptoms and how to respond. They both did the right thing by taking carbohydrate or trying to take carbohydrate. But in Sam's example, he passed out before he was able to get there, since they were not readily available. So this is where we recommend keeping that rapidly absorbed carbohydrate on your person or near you so that you can have it readily available for a low. All right, those are our two examples. Thank you so much for listening to this course. I am happy to be able to do this with you guys, and I hope you learn something valuable from this and know maybe some more resources that you can tap into. And when in doubt, connect with your care team so that we can individualize your diabetes care. Thank you, and have a great rest of your day.